Hello, my name is Maureen Heberly. I am recording this for my HHS 255 class. Professor Redlin is the instructor. This is for medical terminology and documentation, week 6 pronunciation video number 1. Our first word is neuromyelitis. It's an inflammation of the nerves and the spinal cord. When an individual has neuromyelitis, we need to rule out multiple sclerosis, as each disease presents itself similarly, especially when the optic nerve is involved. The next word is thrombocytopenia. It's an abnormal decrease in number of platelets. Individuals with thrombocytopenia will not always have clinical symptoms, and it is usually realized on a routine full blood count. The symptoms are displayed. If they are displayed, it's generalized as weakness, which is a result of blood loss. Psychotropic, to affect mental activity or behavior. Taking tranquilizers are psychotropic drugs because they can affect an individual's mood or the individual's perception. Narcolepsy. This is a disorder marked by recurrent, uncontrollable sleep attacks of daytime sleepiness. Individuals with narcolepsy can lose their driving privileges because of the inherent danger of falling asleep while they are behind the wheel of a car. Arteriosclerosis. This is a thickening, hardening, and loss of elasticity of the arterial walls. Smoking, high carbohydrate diets, and diabetes are some of the factors that can cause an individual to develop arteriosclerosis. The hardening of the arteries can lead to heart attack and stroke. Endarterectomy. This is a surgical removal of the lining of any major artery that has become diseased or blocked. An endarterectomy is often performed on the carotid artery of the neck as a way to reduce the risk of a stroke. Hemolysis. It's a breakdown and destruction of the red blood cells. Red blood cells normally survive 90 to 120 days in circulation, after which they go through a natural hemolysis and are removed from circulation by the spleen. Sonographer. That's what I do. It's a medical professional trained to use ultrasonic imaging devices to obtain images of anatomical structures, physiological processes, and disease states for diagnostic purposes. As a sonographer, I use the sound waves generated by the transducer to look and observe various organs to determine if there is pathology that needs further studies. Ureterocytostomy. Okay, I'm going to do this one more time. It shouldn't be that hard. Ureterocytostomy. Okay, you know what? I'm going to skip that and go back because my tongue's tied. Endometriosis. Presence of functioning ectopic endometrial glands and stroma. Many women experience pain and infertility because of the scarring and spreading of unwelcome stroma caused by the endometriosis. Hysterosalpingo-oophorectomy. This is an excision of the uterus, fallopian tubes, and ovaries. Women with a family history of ovarian, uterine, and breast cancers will request a hysterosalpingo-oophorectomy to avoid getting the disease themselves. Electrocardiogram. This is also known as an EKG and more traditionally the ECG. It is a record of the electrical activity of the heart. Individuals are often given an electrocardiogram when they develop high blood pressure to determine if the primary problem is with the heart. Orchiopexy. This is a suturing of an undescended testicle to fix it permanently into the scrotum. It is important to perform an orchiopexy on boys that have an undescended testicle to avoid problems later in life. Pyelonephritis. It's an inflammation of the kidney and renal pelvis, commonly as the result of a bacterial infection. Fever and flank pain, along with painful urination, are symptoms of pyelonephritis, which requires urgent medical care. Cholelithiasis, presence or formation of stones in the gallbladder. Sharp pains in the upper right quadrant, especially after a meal, is a strong indicator of cholelithiasis. Cerebrovascular, this pertains to the blood vessels that supply the brain. An interruption in the cerebrovascular process can be caused by a stroke or an injury. Morphology, this is the science of shape and structure of organisms without regard to their functions. Researchers have used morphology to learn how chemicals affect molecules. These observations help in finding cures for many diseases. Meningocele. It's a congenital hernia in which the meninges protrude through a defect in the skull or the vertebral column. During a field ultrasound, I perform a thorough exam of the meninges, and it is important to identify spina bifida at its earliest stage, and that is meningocele. Encephalopathy. It's a disease of the brain. It's a dysfunction marked by varying degrees of impairment. When an individual shows signs of diminished cognitive function, they need a medical evaluation to determine if they are actually suffering from encephalopathy. Lymphadenopathy. Okay. Lymphadenopathy. Disease or enlargement of the lymph nodes. When an individual visits his or her physician for an illness, it is common practice for the doctor to perform a lymph node exam to rule out lymphadenopathy. Okay, let's go back to that troublesome word so I can repeat that. Ureterocystostomy. Ureterocystostomy. I don't know. It's a surgical plantation of the ureters into a new site in the bladder. During a renal transplant, a ureterocytostomy is performed to implant the ureter into the urinary bladder. If anything, I should get something for effort on that one. Okay, that is my video, and thank you for watching.